Today, we're going to talk about ADHD versus autism. My name is Veronica Hunter with ADHD What Now, where we look at supporting brains and bodies and growing skills and building relationships when a child in your life has ADHD. Today, I'm delighted to welcome Dr. Laurie Perlis, who has a practice out of Annapolis, Maryland, called the Thinking Tree Psychology. And what I loved about some of the work that she's done, she's contributed to Attitude magazine and added a lot of clarity in there. So the goal is that by the end of today, you will have a greater understanding of ADHD, autism. How do they look the same? How are they different? Do they often go together? And feel empowered to reach out to a practitioner and go further if you need to. So welcome, Dr. Laurie Perlis. So nice to have you here today.
Thank you. It's really nice to be here.
Excellent.
I love working with kids directly, but also one of my favorite things and something that I find very fulfilling is working with parents and educating them and helping them to understand, translating complicated clinical jargon into what does this mean for me and my child.
Thank you. I love that. I appreciate it. Can you start by just sharing a little bit of a story, perhaps of a child with ADHD and autism that kind of shows how they can go together?
Sure. So this is just kind of an amalgam of different kids that I've worked with over the years. And so imagine a child named Matthew, second or third grade boy, sweet, loving, wants to please, has just a joyful energy that sometimes is a little bit much to manage, really bright, has a lot of knowledge about things that he's interested in, and has just a lot of strengths and things going for him. And then in class, his teacher is giving some feedback that he's distracted. He's not finishing his work. He's a bit chatty at the wrong times. He's missing directions. And at home, they notice a bit of that too. Maybe he's also hard to transition from his favorite activities, whether it's Legos or video games. Hard to send him upstairs with multi-step directions and have it actually play out. And maybe he also tends to hyper-focus. Like if he's playing a video game, he won't even stop to go to the bathroom, resulting in accidents. And also at school, they've noticed he's a bit resistant, and at home, resistant to writing tasks. And his handwriting's not very good. And then in other areas, that energy level at school, he's often out of his seat, fidgety, calls out sometimes. And sometimes we'll do things kind of in a repetitive way, the same thing over and over again, even when he's told to stop. And some of it may even not make sense. Like maybe he's doing some movement with his hand, or he's getting up to open a window. And then also on the playground, he seems to be missing social cues. He can be kind of awkward. Like when he tries to interact with kids, it's like a little bit too much, or he's kind of misreading the situation. He can be literal. So sometimes he takes things really literally or really personally when they're not meant that way. And sometimes he's really eager to play with kids, and sometimes he can be a bit aloof, just kind of wants to do his own thing, read a book. And then he can have a great time playing with friends. And sometimes when something doesn't go his way, he can get pretty frustrated, even to the point of losing control and kind of pushing and shoving. And then there's an element of him, he's a sweet boy, but sometimes he just says things that are just, a bit insensitive, maybe a bit inappropriate, and hurt someone's feelings, and doesn't seem to realize that would be the consequence. And then also maybe he at home struggles a bit to settle himself down at bedtime. He's a picky eater. Maybe he's a little bit of a messy eater. So you're seeing all of these different areas where he's doing well, but also some areas where teachers are picking up on it, parents are picking it up on it, that he's having some troubles. So the question that parents usually come to me with in this situation is, number one, is this typical? Is this just part of typical development? Every child is different. We all have our unique makeup. Is this just our boy? Is this just Matthew being Matthew? Or is it not typical? Is it outside of typical development? And if so, what is it? Often parents will come to me already with the diagnostic labels in their mind, we thought maybe it's ADHD. My cousin has ADHD, or, I think I might have ADHD. So is it ADHD? Is it autism? Is it anxiety? Is it something else? Is it gifted intelligence? So what is it? And really the most important question parents, I think, are coming to me with is, if so, what do we do? What do we do about it? So that's sort of kind of a way, if we can, as we talk about this, if we can think about Matthew and sort of the different aspects of his profile, it might help us just kind of talk through it together.
Excellent. So thinking about Matthew then, what elements that you just described might be attributed to ADHD and what might be attributed to autism?
So if we think about the diagnostic criteria for the different disorders, it's basically a math problem. Do they meet this number of criteria for ADHD? Do they meet this number of criteria for autism? So ADHD, for example, Matthew is showing some inattentive symptoms, which is one of the categories. He's also showing some of the hyperactive impulsive symptoms that we would expect in ADHD. And in terms of autism, he's showing some social deficits, and there's also some signs of repetitive behavior. So repetitive behavior can be, taking an action over and over again, whether it's with your body or with an object, or like a really, really obsessive interest that they're hyper focused on, or it can be just being really rigid and having trouble transitioning. There can also be, with both, sensory processing or sensory sensitivities. So there's a lot of overlap and it's hard to figure out. But I think when you're looking at the social problems, for example, is it coming from a complete lack of social understanding and social perspective taking the behavior that's not working? Or is it because a child is just impulsive and they just can't put on the brakes and then they end up, acting inappropriately? And so to really understand, in some ways, I think of some of the things you could see in a child with ADHD, it's just a more extreme version of that in autism. So kids with ADHD can be hyper-focused on something. They can have an obsessive interest, but it just tends to be more extreme and more pervasive in a child with autism. So some of those dimensions is sort of what's the level of intensity? And it might be more consistent with autism. And also really looking at that social piece. That's a helpful way to differentiate if it's really just ADHD related social problems, or if there are some features of the autism spectrum, whether it be understanding social language and how nonverbal communication, understanding how people interact, or being able to put yourself in someone else's shoes, or being very rigid. So it's very hard for you to play under someone else's rules. So some of those you can have ADHD and have some of those characteristics. And then it's a very difficult distinction. There's not a fine line where it's clear, okay, now this is autism. So it's challenging, but there are some ways to differentiate the repetitive behaviors. Some of the more atypical ones are not seen as much in kids with ADHD. So the motor, like hand flapping and things like that. And some of the more unusual behaviors that you would probably see more on the autism spectrum. So we're seeing with Matthew that he's showing some features of ADHD. We're thinking he's showing some features of autism. So what I think is important for families to know is that until 2013, if a child was diagnosed with autism, they could not also be diagnosed with ADHD. It was an exclusion criteria. So it was believed at that time that any symptoms that looked like ADHD were just part of the autism. So that all changed in 2013 when there was a recognition that, oh yes, you actually can have both autism and ADHD. But what's important about that is the research is still very young. So we have a lot more information than we did before 2013, but we still need more information in this area. But the overlap that we are aware of is that anywhere from 30 to 80% of individuals diagnosed with ADHD also will meet criteria for autism, for an autism spectrum disorder. And I'm emphasizing the meet criteria because, again, it's sort of a math problem of, are we checking off all of these boxes based on the assessment that was done? And some practitioners can be very black and white about, okay, well, we have 5, but we need 6 symptoms, so they do not have ADHD. And it's really important to recognize that it's very common to have symptoms, but not meet the symptom threshold, that count, that math problem. And does that mean these things don't affect you in your daily life? Of course not. So that's why I think it's much more helpful to take a dimensional approach where we're looking at actual traits or dimensions where the child is struggling, as opposed to, do they meet this number of criteria? And just on the other hand, when they look at individuals that have diagnosis of autism, 20 to 50% of them also meet criteria for ADHD. So there's quite a bit of overlap.
So then that's fascinating, because what you were mentioning about 2013, then I'm guessing the decisions after that also changed. The treatment protocols or what you would recommend also shifted. Is that true?
I would say somewhat. And I actually don't, I would have to do a bit more research on that to be sure, but just in thinking of, in terms of medication treatment, they have been studying, there aren't really any medications that are approved to treat autism. There are medications that are approved to treat ADHD. So with autism, you're more treating the symptoms. So maybe you're treating hyperactivity, or you're treating aggressive behavior. So there is some research being done to understand how ADHD medication treatment does it affect kids with autism who also have autism? Does it affect them differently? Does it work differently in them? There's evidence on both sides at this point that it can have different reactions in kids with autism, but also that it can be helpful in kids with autism. So I think more research is needed in that area for sure. But there's also a lot of research in terms of understanding the genetics and the causal factors and what that overlap between autism and ADHD. So for example, there's a lot of evidence of shared genetics. So if you are in a family where someone has ADHD, you have a higher risk of someone else in the family having ADHD and autism, and it works both ways.
Mm-hmm. And to give people a little bit of an idea of what is possible, because then like you said, one of the things that people often ask is, what's next, or how can I help? So what is next, or how can you help these social challenges?
So it's really a team effort. There's always an element of school involvement. And I've been fortunate to have a lot of school teams that have wanted to include me in their meetings and really all work together to support a child that's struggling socially in the classroom and on the playground. So it's really getting the team together to figure out what is needed, what can we do differently in school to support the child. So maybe it's a lunch bunch, or maybe they need a 504 plan where they can have certain accommodations to support them in the day. And then there's working with the child one-on-one on explicit teaching of social thinking, of how do you navigate when you want to play with someone, like how does that all work? What's expected behavior, what's unexpected behavior, and what are the consequences of unexpected behavior? And are you okay with that? Because sometimes you have to get the child's buy-in. Why should I do things differently? We have to find what their complaint is. Not just what the parents think should change or the teachers think should change, but what is the child kind of not okay with? And that gives us an in to, well, okay, well, if that's bothering you and you want mom and dad to stop nagging you about that, let's work on this together. Let's come up with a different plan. So there's, individual and family-based therapy. You can have, there's social skills, social thinking groups. I would definitely refer people to the social thinking curriculum, which is Michelle Garcia Winner's program, which has a ton of resources, and there's a lot more out there now than there used to be. But it's really fun. I use a lot of books and workbooks and activities like that to teach children, just like you would teach them math, teach them social perspective taking, social thinking, how to understand and read body language. And it's just an ongoing work in progress I consider myself the once a week or once every other week coach. And then the parents are the everyday coaches. So everything I'm teaching the child, I need the parents to know also. So we're all working, and if the teacher and counselor know too, even better. So we're all using the same language. For example, that was an unexpected behavior. We're all using the same language. That makes me uncomfortable. Of course, there's also, medication treatment that is sometimes really, really helpful for kids, because we have to recognize that they are limited in what their self-regulation system is able to do. In addition to being very immature, there's also an extra layer of immaturity when you have a diagnosis of ADHD or autism, meaning they have even less control over their behavior. So even if intellectually they want to do something different, or they know the right thing to do, once their emotion is activated or they're really excited, it doesn't even have to be a negative emotion, they can lose control of their system, and then the unwanted or unexpected behavior will occur. So medication can be helpful with that.
Mm-hmm, mm-hmm. Awesome. Another thing that I thought was interesting about Matthew, you described writing challenges or resistant to writing. Where did that come up, or how did you include that?
So kids with ADHD and autism there are a lot of other areas that are often impacted. And one of them can be fine motor and gross motor skills. So often there have been studies where kids with ADHD, when they're on a stimulant medication, their handwriting improves. So there is a connection, there is some association between symptoms of ADHD and those fine motor coordination skills that are kind of the precursor to handwriting. And it's also thinking about the whole child rather than a one-dimensional, is this kid inattentive? I think when the layperson thinks of these terms, ADHD, they have like a one-dimensional idea of what that means. Often it means a boy who is bouncing off the walls and calling out, the very hyperactive picture. And then for autism, it may be a kind of a stereotype of a kid that's just very awkward or has no interest, doesn't make eye contact and doesn't interact. And I think it's important to get away from those kind of narrow understandings of kids and really think about the whole child, because there are so many individual differences among kids with ADHD, among kids with autism, among kids with autism and ADHD. And again, those plenty of kids who have some symptoms or features, but maybe we don't have enough evidence to say they meet criteria. That doesn't mean they're not struggling in these areas. So there's sensory processing, there's academic effects, there can be reading comprehension effects from ADHD and from autism in different ways. For example, with autism, if a child has trouble perspective taking, like really understanding what's going on in another person's mind, it can be hard to understand characters' motivations in fiction, or to really think abstractly about what they're reading and connect it to other things. And with ADHD, it can be difficult to multitask, read, especially while you're still learning to read, and then also think about what you're reading and make connections between what you're reading and something else you've read or something else So you really have to zoom out and look at the child's whole world to understand how these symptoms or features or characteristics are getting in the way of their daily functioning. And achieving what they're capable of. So hopefully you can hear that I'm trying to get away from, we need to focus on what do we call this, and more on the individual child and where are the areas that they're struggling.
Which is an amazing perspective. And then how does that impact how you support the kids going forward once you've met them?
So I think one thing that I emphasized in the attitude talk was that for each parent, it's important, you have to sort of write your own child's story. You have to create your own child's story of what are their strengths and what are their challenges. And that gives you a roadmap of what do we do next. So that would be my role, is joining the parents in, okay, let's start writing this story. We have a lot of information. You have his whole life story in your minds, and and how do we work together out adding more data to formulate, to really understand not only the behaviors that the child is showing that are getting in his way or her way, but also, if you think about the behaviors as just the tip of the iceberg, it's so important to understand what is driving the behavior. So, and therein lies a lot of the trying to define whether it's ADHD or autism or both. So for example, you can see a child who's inattentive. They could be inattentive because they have ADHD and it's difficult to manage their attention. They could be inattentive because they're in sensory overload, because that's part of their autism. They could be inattentive because they're doing something that's really hard and it's making them anxious, so they're overwhelmed. They could be inattentive because all they can think about is this really exciting video game that they're obsessed with, and they can't change the channel from that to what they're supposed to be doing in the classroom. So if we understand what's driving that behavior, what's underneath the iceberg, then we can start to say, well, that sounds more like autism driving that. That sounds more like ADHD. But often it is near impossible to make those fine distinctions. And at the end of the day, it's not necessarily crucial to us formulating a treatment plan or an assessment plan. We can certainly try to get more information. So Matthew, imagine that I have met him and his parents for the first time. I'm formulating my hypotheses about what I think is going on. And I certainly would have suspected that could be ADHD, could be autism, there could be some anxiety, there could be some fine motor sensory problems, maybe even some language processing problems in terms of understanding non-literal language. Kids can have advanced vocabulary, very sophisticated verbal abilities, and still have subtle areas of language processing that is very challenging for them. And that can be extremely confusing for parents, for teachers, when you when you have a child who's clearly incredibly bright in so many ways, and then there's just these unexpected differences or weaknesses that are really hard to make sense of. So it can be helpful if you can make those fine distinctions, because then we can address, okay, he's inattentive because he has ADHD and he doesn't have that level, he doesn't have the brake system that he needs. Okay, we can give him some medication, we can make sure he's moving, we can give him some fidgets at his desk, and hopefully that will help. If it's because he can't stop thinking about that video game, the medication might help, but we might also need some other strategies. Like maybe he gets to, a reward is that he takes a break and he gets to draw a picture about his video game, or there's some way to channel that energy. And also working with that child to have different strategies that can help him when he has the self-regulation maturity to even do it, to use breathing techniques or visualization techniques so that he can start to have more control over what his brain is doing.
What a great summary, because there was a lot of what you include in there. You touched on the medication, you touched on skill building with things like social thinking, and then the relationship and involvement of the parents too, and so that everybody has the same language. How do you involve parents? Is it like a group session, or do you offer a short amount of training after working with the kids? What does that look like?
So it's definitely a case by case basis, as every kid is different, has different needs, and every family is as well. So I would say typically I'm working with, it's sort of, we all are meeting together to establish how things have been going and what is, what are we going to work on today? How did the last thing we tried go? And sometimes it's helpful to have some parent time because kids usually aren't the best reporters of how things are going or what happened in the last couple of weeks, especially depending on their age and just who they are. And then, when the child is comfortable, then it's a teaching model. So I spend time with the child and we have a specific set of skills we're working on that day. And then we bring the parent in to show them, okay, here's what we are teaching you now. So we've learned this type of breathing and relaxation technique that we can do when we're upset. And now we're going to teach you. And then you guys are going to go home and practice at home. So certainly that's sort of my typical model. And then also sometimes it's really helpful to just have full parent sessions where we're really just talking through what are the challenging behaviors, what are you struggling with, how to react, and how can we really troubleshoot and work through this together and come up with a plan of things to try differently without even having the child involved at all. And I think both are really, really helpful, both of those sort of models or methods. Also, there are I don't run any groups, but some centers and practices have groups that run concurrently. So you'll have your child will be in a group with peers, and then there's a parent group where all the parents are getting information and support. So those, if you can find a practice, if your child has autism or has ADHD, and you can find a practice that has really like structured programs like that, often it's like a set of so many meetings or so many sessions and you're working through a curriculum, I would definitely recommend looking into those because the parent support piece is so essential. It's very challenging to know how to parent our kids in general, but then if you have a child that's different or doesn't react to the typical parenting, recommendations, it's very, very difficult. So I always say to parents, sometimes what you can do differently is probably you're going to get more bang for your buck working on that than expecting your child to really just make all of these changes and use all these strategies because they're just not there yet. They're little.
Awesome. What if a parent is sitting here saying, I love everything I'm hearing and I want to find somebody to work with who will do what you're talking about. Now you're in Maryland and perhaps you do telehealth, potentially. We'll talk more about that in a moment. What are some key questions they could ask to help find a practitioner that has a similar philosophy or approach?
Well, I think as a starting point, I would just kind of want to talk through what are the different options. If you have a child like Matthew, who you're wondering, is there something beyond typical Matthew being Matthew? Is there something going on here that we need to address? I know a lot of parents do their own research, and sometimes that works for some and doesn't work for others, but there are a lot of scales available for free online that I use in my practice. So they're parent report scales, standardized scales. If you're wondering, does my child have ADHD, as a starting point, start reading about it. Start listening to talks about it. Because if you go through the criteria, you might say, check, check, check. And then that gives you a starting point of, okay, I have this suspicion. Where do I go from here? I think it's really, really important for parents to identify what are my goals. If I'm going to a psychologist or psychiatrist, or I'm going to my pediatrician specifically about these concerns, what is my goal? Do I want to know, yes or no, does my child have ADHD? Is that really important? I want to know what to call this. Or do I want to know about treatment options? Do I have a specific goal in mind, or do I really just want to understand my child better? Because that would dictate kind of where you go in terms of getting that information. So a lot of parents start with their pediatrician. A lot of the pediatricians that I work with use the Vanderbilt ADHD inventory scale, which is questionnaire for parents and teachers. And it falls into that, do they check the boxes? Do we have the 6 out of 9 symptoms that are required to make the diagnosis? And often if they don't, then we're kind of left. So we haven't really moved forward. You can go to a child psychiatrist, and most psychiatrists will do kind of extensive interview with parents and interact with the child. So you have that iceberg information of what everyone's seeing and kind of what the child looks like, but we're not really getting at that underneath of what's driving the behavior. So that's where a more comprehensive evaluation with a psychologist or a neuropsychologist could potentially be helpful. So in my practice, there are some cases where I don't necessarily do a full evaluation that includes academic testing and all of that. Maybe we're just looking at a really in-depth understanding of where the child is right now by doing parent questionnaires, teacher questionnaires. I'll spend a lot of time with the child so that we can figure out a sort of initial assessment of what's going on, with the caveat that children are moving targets. They are developing rapidly every day. So often the diagnostic process is ongoing anyway. So let's say even if you do a 6-hour testing, 6-hour evaluation with lots of different tests, it's still a snapshot in time. There have been many times where I've evaluated a child and then they continued with me for some type of treatment, and I will learn things, or things under the iceberg will become more clear to me that I would never have known just in the context of that 6-hour evaluation. So it's really sort of a starting point of where we are. And I think the questions to ask if you're going to a clinician are, first of all, what kind of evaluation here is what's going on with Matthew. What do you recommend? What kind of evaluation and why? I think it's important to emphasize too, that there's no particular test or tests that are essential. So I think it's important, the expertise of the clinician is really probably the key factor. So I would ask questions, do your research. Do they specialize in this area, or are they more generalists? Do they specialize in a certain age group? Are they really familiar with the overlap of ADHD and autism? I would also ask them their thoughts on how accurate are our diagnoses, and what happens if he doesn't meet criteria for a diagnosis? Like, how do we understand what's going on with him if it turns out that he doesn't really meet criteria for these diagnoses? And I think what I've found with families is, if once we're talking and they're naturally asking questions and I'm asking questions, often I think they can hear my approach, and that dimensional approach, rather than a really straightforward, we will just know yes or no whether they tick all the boxes or not. I think that, so if you can get that sense from someone that their approach matches, and I'm not saying my approach necessarily matches with everyone, what everyone's looking for, but if you can get a sense of their approach and what the end goal is, I always ask parents, what are your goals for this evaluation? What are you hoping to get out of it? And what are the questions that you're hoping I can answer for you? It's extremely important to set that from the beginning. And even at the feedback after the testing is done, I ask that question again. Just let's be clear, what are you hoping I can answer today? Because that's really what's most important. As the clinician, we might be thinking, well, I need to make all these diagnoses and I need to explain why. But that's not really what I'm getting the sense that parents want. Parents just want to understand their child and know what to do next.
Awesome. And it's all around amazing advice. Plus the idea to think of what do you want in advance. That's not something I did. I went in there and I remember, I think, being asked some questions similar to that. I'm like, I don't really know. I don't know the answers. So having everything that you shared here today, from the very beginning, as far as like, what might this look like, so that people can know who to reach out to potentially, down to some great questions to ask to find the practitioner for you. It's been amazing. Thank you so much. Can you share a little bit about your practice? Where are you located?
So I am part of a lovely group of colleagues, mostly psychologists and one social worker at a practice called Thinking Tree Psychology. We're in Severna Park, Maryland, which is a suburb of Annapolis. And we serve children, adolescents, and young adults in our practice. And I do a combination of evaluation, psychoeducational evaluations, and therapy. And I work with children from as young as 4 or 5, all the way to kind of mid to late 20s. Typically, is my range. And I treat a lot of individuals with ADHD, with autism spectrum conditions, and with anxiety disorders. Those are probably most commonly, those are some of the most common things that I'm working with.
Thank you. And that can be found at thinkingtreepsychology.com. Is that correct?
Yes.
Okay. And is there a way for people to be able to work with you if they live outside of Maryland?
So I am in the process of becoming part of something called SciPact, which is a compact agreement among a number of states in the US. So it allows someone who's licensed in one state to practice in other member states. So if anyone is interested in having a telehealth consultation with me and they're not in Maryland, I would encourage them, they're welcome to reach out to me, or I would encourage them to, you can just Google SciPact and see if your state is on the list. And if your state is on the list, then I would be able to work with someone via telehealth out of state.
Awesome. I love our ever growing abilities in leveraging technology for our own good. Awesome. Thank you so much for being here today and giving us a summary of ADHD, autism, how to see each of those, and then some ideas of what help looks like and how to reach out for help. So thank you, Dr. Laurie Perlis, and you can be reached at thinkingtreepsychology.com. And what a delight to have you here. Thank you for sharing your expertise and helping families.
My pleasure. It was really nice to be with you.
To all the audience, we'll check down below for the website and hit like, subscribe, and we'll see you later.